possible for me to have a successful dental implant at 70?
Absolutely. We call age no bar, right? Absolutely. Age is no bar for anything and everything that we do. Over a period of time, like, being in practice for over 3 decades, and I have patients, I can vividly think of last week we had a patient, 94-year-old lady. She had a missing tooth on the top left. That tooth, which was an anchoring tooth to the partial she has been wearing for the longest time, and she didn't need dental implants for the last 20 plus years that she has been wearing this partial, which is holding absolutely fine. However, now that anchoring tooth on the back that completely broke. So guess what we are going to be doing? So we removed that anchoring tooth which completely broke. We did a bone grafting because we could not place the implant at the same time. So we will be placing that implant in about 3 to 6 months over after she completely heals. My oldest implant patient is 106. Same thing. We had to place an implant to anchor a partial. My another oldest implant patient is 86 years old. Guess what? She was getting married at 86 years old, and she wanted to have good looking teeth and for holding her denture, and she did not want those dentures to be popping out when she was smiling for her wedding pictures, and she did not want her spouse to know that she will be removing her teeth and she wanted them to be fixed. So we ended up doing some implants to anchor her dentures. So speaking of that, age doesn't matter. More than that, health is what matters. So your overall health is connected to having healthy teeth. So get some good teeth and dental implants irrespective of your age. Bone density to an extent matters as compared to the age. And if you have good bone, irrespective of your age, and it does not matter, you can still have dental implants. The problem that we see is commonly when people get older, they get like a lot of comorbidities, what we call it as, or medical conditions like diabetes and osteoporosis, and people have other conditions that are going to affect their mouth on a lot of medications and dry mouth and all of that. And people are also going to be smoking. These are kind of going to be relative contraindications, although they are not like a true contraindication. Despite having those medical conditions or could be smoking, you could still get the dental implants. Speaking of the benefits of why you should be considering dental implants even at your age of 70, better chewing, improved speech, and preserve your facial structure so you don't have to worry about aging. And it could often be life-changing, for seniors. So do not worry about your age. Get the dental implants. Go to your dentist, go to your periodontist, go to an oral surgeon, and talk about the implants and how they can benefit you.
And don't worry about your age.
Absolutely, yeah.